Over the next minute, you'll breathe at least 12 times in and out without a problem. But there are a growing number of people who fight to breathe, each breath more difficult and painful than the last. In this week's To Your Wellbeing segment, a look at pulmonary fibrosis, the symptoms, support, and solutions developed right here in the Triad.
I was very lucky.
Fred Haley caught it early.
I had smoked for 35 years. I became 35 pounds overweight after I retired.
He has idiopathic pulmonary fibrosis, or IPF. It's one of the most common and deadliest forms of pulmonary fibrosis.
Listen to the back.
Dr. Murali Ramaswamy is the director of the Pulmonary Fibrosis Program at LeBauer Healthcare and Cone Health.
This is a scar that happens in the lung tissue, but by itself. The scar gets worse and worse with time, and that makes the person cough, have shortness of breath, ultimately dependent on oxygen, making it difficult even to talk, and then ultimately they die from the disease.
Similar to advanced lung cancer, patients usually die within the first 2 years of diagnosis.
Deep breath, blow it out, blow, keep blowing, keep blowing.
But Fred is blowing away the odds.
Big deep breath in. Good.
He's on Esbriet, or pirfenidone, which can slow down scarring and damage in the lungs.
The fact that he's alive and the fact that he's not on oxygen, the fact that he's extremely functional is a testament to the scientists who have developed these drugs.
Deep breath, blow it out, blow.
Fred's IPF is also managed through in-office breathing tests like this one that monitor oxygen levels.
You gonna walk behind you. You got it. All right.
Walking tests also tell doctors if patients need to carry oxygen tanks to help them breathe.
Oxygen level is 94, heart rate is 98.
He's kind of writing the book on what you want to see happen in patients.
Absolutely. So I spoke about the pillars of IPF, or pulmonary fibrosis management. He has done all of that, including quitting smoking, losing weight, taking care of his health, being an activist for the disease.
Part of that activism is the Pulmonary Fibrosis Foundation support group. It's one of 2 in the state, which he co-founded right at Cone Health.
4, 5, 6.
Pulmonary rehab is a place where patients get support, exercise, and encouragement.
I may die of this disease. I may not die of this disease. But you know what? It was pretty certain about 5 years ago that was going to be what and I was going to do everything I could to fight it.
Part of that fight, research to help others.
He's on his 3rd clinical trial right now. And the trial he is on right now, he was the first patient to go worldwide on that trial. He is not only making a difference for others, but also for himself.
I have beaten the statistics.
There is no cure, and doctors don't know why IPF happens, but there's progress.
Scientists are coming up with inhaler therapy, nebulizer therapy, IV therapy. These are different forms of attacking the disease.
And there's hope.
I end all of our support group meetings with, remember guys, we fight. And that's really what you have to say, we fight. We fight, not going to give up, we fight.
So the research Dr. Ramaswamy is heading up is cutting edge. People like Fred are not supposed to live past 2 to 5 years with IPF, but Fred is now in year 8, and he's doing great.
So you said that there's no real cure or reason why this happens? We don't know?
No, and that's the most frustrating thing for doctors, because Dr. Ramaswamy says 20% of people with IPF have people in their families who also have IPF. Many of them are smokers, but this also impacts people who've never smoked a day in their life, so they could be at risk also. So if you ever have any shortness of breath experience, even if you think it's just like, oh, this could just be, the humidity, or, it's an orange level day outside, right. I'm just having some trouble breathing. Even if you have something as you think minor as that, make sure you get it checked out, because it could be something else.